Common diseases are the common cold, gastroenteritis, strep throat, pink eye, gonorrhea, whooping cough, rotavirus, and HIV/AIDS. These diseases can be viral, bacterial, parasitic, or fungal, and are caused by pathogens being passed from one thing to another living being. They are transmitted by mucus, blood, breath, saliva, and sexual contact, in addition to contaminated surfaces which act as a fomite. People most at risk for these diseases are children. Ways to prevent these diseases are to build up resistance with nutritious food, regular sleep, and exercise, and take the daily recommended amount of vitamins. Wash your hands frequently, try to keep your hands away from your face, and to get vaccinated. Antoine van Leeuwenhoek was a scientist and microbiologist from Holland who discovered strep throat in 1674. He was the first person to describe and observe single-celled organisms and is commonly known as the father of microbiology. More currently, HIV was discovered in 1983 by a team of scientists led by Luc Montagnier at the Pasteur Institute in Paris, France. A rival claim was also made by a group led by Dr. Charles Gallo, which published details of their discovery of HIV in 1984. In 1987, the two teams finally agreed to share the credit for the discovery of HIV. Communicable diseases are those that are spread from one person to another person, from animal to person, or vice versa. It is likely that everyone will come into contact with a communicable disease at some point in their lives. Causes of these diseases are dependent on a number of factors, including the agent, environment, and transfer method. One of the primary causes of a disease is the environment. Diseases are much more likely to spread in places where hygienic practices are minimal. Being around others with these diseases is also a high-risk factor. Care should be taken to avoid direct contact with those who are ill whenever possible. Communicable diseases can be transferred in a number of different ways, the most dangerous of which are transferred through the air. Pathophysiology is the functional changes associated with or resulting from disease or injury. Gastroenteritis, or the stomach flu, is the inflammation of the stomach and intestines from bacterial toxins or viral infection. It infects through close contact with infected persons or through individuals eating or drinking contaminated food or beverages. Diagnosis begins with taking a history of the illness to inform the healthcare provider of vital information. In a physical exam, a healthcare provider uses the senses to identify signs or disease. Microscopic examination can be used to identify microorganisms. The microorganisms can be obtained through throat swabs, blood, or other bodily substances. The microorganisms are then observed under a microscope. In some cases, a diagnosis can be made from this alone. However, the culturing process takes time. After bacteria have been isolated, a culture and sensitivity test is performed. Here, various antibiotics are placed on the dish. If the bacteria is sensitive to the antibiotic, it will fail to multiply and kill the bacteria around it. Some diseases, such as HIV or strep throat, can be detected in minutes with the use of rapid tests. These tests do not typically look at the microorganism itself. Instead, it identifies antibodies or antigens of the microorganism. Antibiotics are used to combat bacterial infections and are classified based on the mechanism of action. This model shows where various types of antibiotics work. Examples are to inhibit a bacterium's ability to turn glucose into energy, or its ability to construct its cell wall. Antibiotics do not work on viruses, but antiviral medications do exist. An example for this is the medication for HIV/AIDS. They are classified based on where they interrupt the viral cycle. The current recommended treatment for HIV/AIDS is at least 3 antiretroviral drugs known as highly active antiretroviral therapy, or HAART. With new technology, HIV is being diagnosed more in adolescents than in the past. This allows for better interruption of the viral cycle and gives hope for new preventative methods against the virus.